Assalamu alaikum viewers, I hope you're all good and your families are keeping well. Today I would like to talk about melasma, which is a skin disorder. There are skin pigmentation on the face, especially in the female population. Unfortunately, it's also called chloasma or mask of pregnancy, and it's more common in females, age group between 20 and 40 years, and it is also common in darker skin. There is a classification for skin color we call Fitzpatrick classification, being 1 the fairer and 6 the darkest. So it's more common in skin color 5 to 6. The cause of melasma, it's not fully understood. However, photoaging disorder that in which there is increased production of the melanin through melanocytes. As our age advances, our skin is exposed to the sun for a longer time, and if we are not observing the protection, so it can trigger melasma. However, this mechanism is not fully understood, and it is also reported that 60% of cases have melasma in their families. So, for example, if someone presents with melasma, there are 60% chances that they are run in the family as well. It also depends on the length of sun exposure and lack of protection as well. For example, the people who doesn't use sun protection SPF like 50 or 50 plus, they are more exposed to develop this condition, and there are certain hormonal changes with pregnancy which can trigger these type of facial pigmentation as well. There are certain medication and other products such as perfumed soaps which can trigger photogenic reaction to trigger this condition. This mechanism also not fully understood. However, it can be a cause as well. Melasma, there are 3 particular types. Grossly, one is epidermal, which is more superficial, one is dermal, and the other is mixed. The epidermal, it is the borders are well defined because it's superficial. In dermal type, the borders are fading and they are faint, so it is difficult to see the borders in melasma that have the dermal component. And what are the impacts? The impacts are very easy to understand. If you have dark patches on the faces, so they have psychosocial issues. It can cause anxiety, depression. It can affect career as well, and it have special impacts on your social life. How we diagnose melasma? The diagnosis is mainly clinical. When we see the skin under a magnifying lens that we call dermatoscope, so we look for certain signs, and it helps us to diagnose melasma. There is another condition, another procedure as well. We take a small biopsy, a diagnostic biopsy under local anesthetic, and that helps in the diagnosis as well. And to grade melasma, we use a score we call the NASI and ASI. When it comes to treatment, so the first most important thing is sun protection, just to be in the shade, especially between 11 and 3 o'clock in the daytime when the ultraviolet radiation is at its peak. So sun protection is obviously very important in these cases, and there are other measures that you can take as well. When it comes to treatment, there are topical preparations such as hydroquinone or tretinoin, topical steroids, tranexamic acid. We can give some oral tranexamic acid as well. In Pakistan, there are like a lot of tretinoin and hydroquinone combination. There is a cream we call Pigmanom, which I will put in the description, which has good results, what the clinical data show. And personally, I have loads of patients who benefited from this cream. It's called Pigmanom, and it's available in Pakistan as well. When the oral medication doesn't work, then we can consider some procedures such as microneedling or chemical peels. These are the procedures which can help to reduce the amount of this pigmentation. Laser is obviously the top treatment. We use like IPL, intense pulse laser, to treat this condition. There are other types of lasers as well, such as Q switch, anti-yoke, fractioned, and picosecond lasers. These are different type of lasers which we can use to treat melasma. The bottom line is prevention is better than cure. Sun protection is most important, and there are a lot of different treatment options that we can consider. But my suggestion would be to contact the appropriate dermatologist to diagnose the condition properly, to investigate it, and to treat it according to the guidelines. Thank you. May Allah keep all of us safe. Allah Hafiz. Assalamu alaikum.